Major cities in India have started easing COVID-19 lockdown restrictions. Now, it comes as infections in the country fall to a 2-month low. But authorities are warning against any complacency. They say that infections are still spreading rapidly in rural areas and some southern states as well. Neha Punya joins us live now for more from New Delhi. Neha, signs of things returning to normal in some parts of India. What steps are being taken to prevent another surge?
Well, this is a very gradual unlocking that we're seeing, Dawn, led largely by regions like Delhi and Maharashtra, which have been the worst hit during the second wave, which saw India posting record number of deaths and cases in the months of April and May. Here in Delhi, for example, you have the government allowing metro services to resume, but only at 50% capacity. It similarly said that private offices can also start operating, but only half their staff can come into the office premises. You have malls and shopping complexes in Delhi, which will now operate on alternate days. And similarly, the government has said that any area that sees huge people gather in large numbers will not resume operations. So restaurants, bars, gyms, these are all places that are not opening just yet. Maharashtra also similarly taking a very cautious approach. The government there has introduced 5 levels of unlock, but in the city of Mumbai, restaurants have been allowed to operate at 50% capacity till about 4 p.m. local time. The local train services will resume, but only essential workers will be allowed, because the worry in all of these regions is that a third wave is just round the corner. The Delhi government says that as deadly as the second wave was, the third wave could see the capital adding more than 40,000 cases every single day. That's 10,000 more than what Delhi saw this time around. So governments all across the country saying they cannot afford to be lax, and clearly also learning their lessons from what happened before the second wave hit India, when all restrictions were lifted overnight, and we saw how that played out over the months of April and May.
Lessons continually being learnt as we deal with this pandemic. But meantime, Neha, the mass vaccine rollout that's currently ongoing in India, the country is struggling with that as well. There are now reports of iniquity in the distribution of shots as well.
Absolutely. I mean, so far India has administered more than 230 million shots. That's a huge number when you look at it in totality. But what this essentially means is less than 5% of all Indians have been fully vaccinated. And we've seen how there's a massive inequity problem because of the fact that any Indian who wants to get vaccinated needs to register on a government platform. Many Indians are digitally illiterate. Many of them don't have smartphones. That's been a huge hindering block. Beg your pardon. The other problem, of course, has also been the urban and rural divide. We've seen in urban India 1.7 times more shots being administered than in rural India. And supply has been a huge problem as well. While the central government was in charge of procuring vaccines in the first phase of this massive vaccination drive, when it opened up vaccinations to all adults, that's about 950 million adults, it told states they must procure their own vaccines. And as a result, we've seen many state governments complaining of shortages. They've floated global tenders, but have not heard back from companies, all of whom have said that they only want to deal with one entity, that's the Indian government. So Prime Minister Modi, addressing the nation a short while back, he's now said that the central government is once again going to take over the process of procuring vaccines for all Indians. He said in 2 weeks' time, the government will ensure that all adults, everyone above the age of 18, will be vaccinated free of cost. Private hospitals can still procure their vaccines from firms, but they cannot charge Indians $2 over the base price that they've paid for this vaccine as well. And this has been a huge criticism. This policy that was criticized by the Supreme Court just last week, it called this change effectively the government saying that all senior citizens and those above the age of 45 were getting vaccines free of cost, but everyone above the age of 18 to 44 was having to pay for it. The Supreme Court called this arbitrary and irrational, and many Indians had also complained of this. So the Prime Minister now effectively announcing that change that will come into effect in 2 weeks.
Neha, thank you for that update. Neha Punya there in New Delhi.